I know it's been a while and I disappeared from the channel yet again, and I always come back and tell you guys, no, I'm back now. I would disappear. Then just like the avatar, when you need me the most, I disappear. But today, I'm back with yet another video. So just sit back, grab a piece of paper if you want, and your pen, and let's go. Hello and welcome to Hospital Survival Guide. This is season 2, episode 6. This is a series on my YouTube channel where we look at hospital topics, how to survive in the hospital, hospital-related things, and pretty much generally hospital life. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications of such amazing content every time I post. Drop a like, drop a comment to show some support. And let's go. So in this particular video, I was actually thinking and contemplating what exactly am I going to do for the channel, given that the channel is almost even reaching 16,000 subscribers. At the particular moment, I think we should be left with 48 subscribers to reach 16,000 by the time I was recording this video. So hopefully by the time I even post this video, it would have already reached 16,000 subscribers. So I decided, let me do something special for 16,000 subscribers. And like I always do, I always bring you guys the juice. I bring you the juice. You know what I'm saying? Anyways, so in this particular video, I'm going to talk about 5 mistakes you keep making during your internship or junior residency. First of all, let's get things clear. It's junior residency, guys. It's not internship. I mean, who likes to be called an intern? Like, where is the intern? It's a very, very derogatory term. And so let's just refer to it in a civilized manner and say junior residency. So as you already know, the junior residency limit or the length has been reduced from 2 years from those that are training outside, 1 year, 6 months for those that are training in house, as in the country, to 1 year for pretty much everyone. So whether you are trained outside, trained within the country, you're all going to be doing internship for 1 year or junior residency for 1 year. So it means that you have to learn very, very fast. You have to catch up very fast. You have to show competency very fast if you want to finish and if you want to specialize as quickly as possible. If you're one of those people that disappear after every rotation for Lord knows how long, you're probably going to do it for 2 years as well. So I decided to put together this video to talk about 5 mistakes that you keep making during your junior residency. This is going to be for those that are still doing junior residency and for those that are yet to begin junior residency. Even if you're in medical school and you're fantasizing about when you're going to become an intern and you'll probably be swimming in money, PS you won't. I'm joking. So this is a video specifically for you. So the first and foremost thing, the mistake that you keep making during your junior residency is you want to specialize in one day. What do I mean? Isn't the goal of junior residency aiming for you to specialize or rotating in other departments to get the basic information so that you can choose where you want to go? Yes, it is, but the mistake that most people actually get into a rotation with is on day 1, they put themselves under pressure to know everything, to be almost as good as the registrar, to be almost as good as the consultant. And this feeling causes a lot of anxiety because yes, there are a lot of expectations that are there when you're doing your junior residency. The expectations from your family, the expectations from your friends, the expectations even from the neighbors, the expectations from the students on the ward. And imagine if the students you're teaching find out that you failed the end of rotation exam. How are they gonna listen to you? Anyways, so you get into a rotation, for example, let's say you get into pediatrics and you want to specialize, or you want to reach a certain level and compare yourself to maybe the registrar that is there, or compare yourself to maybe other colleagues that have been in the department longer, or maybe even the consultants. That would be like a big stretch for you to compare yourself to the consultant. So what am I trying to say is that every rotation that you're going to go to, have an open mind. Get into the rotation thinking, well, this is something new. Of course, yes, I've experienced this before as a student, but this is different. This is something that I haven't done before independently, and I'm willing to learn as much as possible. I'm willing to be guided. Once you get into the rotation with that mindset, it means that you'll be able to learn from the consultant, you'll be able to learn from the registrars, you'll even be able to learn from your colleagues. If you have that mentality of I'm always behind, I'm behind, you always feel like you're drowning, and your whole rotation will be miserable. Hear it from me, your whole rotation will be miserable and you will barely learn anything, because half of the time you'll either be too scared to do certain things, you'll be too anxious, or sometimes you want to do certain things, or you try to do certain things and they turn out wrong because you've done them too early without actually learning the right way. There's actually a story of a certain intern that went to theater too soon. I think that was in obstetrics and gynecology at one of these hospitals. I'm not going to mention where. And apparently he went and he cut a lot of structures just in doing the C-section. And after that, they said this chap should never be allowed in an operation theater at all. So give it time. It's a learning process. You can't learn everything in one day. Of course, if you're in one of these level 1 hospitals, where you see the whole community in one day, you actually get to learn see a lot of things on one day. So someone who's rotating at these level 1 hospitals, please share with us your experience in the comment section below. So the first mistake that you shouldn't fall into is actually trying to specialize too quickly when you're still a junior resident. Remember that junior residency is not specialization. You are an intern, for lack of better terms, a junior resident, meaning you should know your limitations, what you can do and you cannot do. So we can't expect you to do advanced level procedures as a junior resident, moreover on day one. Of course, if you're a very overzealous 7th year and you learnt a lot of these things, then you look like as if you are a bit, in lack of better terms in English, chenjelad, if I can use vernacular, a bit clever than the others and a bit sharp than the others. But for the bulk majority of the people that us who are average, generally don't stress yourself. It's a day-by-day learning. You're learning things. If it's procedures you don't know, you're going to learn them eventually and you're going to actually master these procedures. Then the second thing, or the second mistake that you keep making as a junior resident, is not following the orders of the seniors, not following seniors' orders. What do you mean? You're like, Dr. MK, what do you mean? You follow what the seniors are saying. No, you don't. Suppose if a senior were to come and do a round, which junior resident would actually go and check the files to actually read through what the senior has done, the investigations have done? Who would bother themselves and say, oh, you go ask the patient, have you done this chest x-ray that was written? If they haven't, find out why. Has the nurse taken the patient to x-ray? If she hasn't, why? Is she working alone? Can someone else take the patient? Can someone else escort the patient? If the patient can't move, has biomed been called? Has radiology been called? So often seniors will come and leave orders that this patient must do a chest x-ray, they must do an ECG, they must do an echo, they must do these blood investigations. And being a senior is nice, guys. You can just come, right, disappear, and you go off your way. Of course, when you become a senior, don't do that. When you actually write investigations, make sure that you at least initiate those investigations, or at least even write the lab form, guys. There are some seniors who just come and write in the file and expect you to guess and like throw bones and like chest x-ray. That's not how it works. So as you transition and become seniors, I want you guys also to do things in the right manner or do things in the right way. So the thing is, we often don't follow the investigations or the orders that are left by the senior. For example, you have a major ward round and the consultant will say this patient must get an ECG and echo, try and push, try and liaise, be nice with the nurses. If you're nice with the nurses, you're nice with the in charge, they will help you out. If we are working with people that are just reasonable, they will help you out. And every time you tell them that, okay, this patient needs to do this and that investigation, they'll do it for you. And of course you look like as if you're serious, but imagine every time the consultant comes and you're still reviewing the same patient, no new labs, no new investigations, nothing. Of course, it doesn't mean that you should run helter and skelter for each and every single thing, because some things are well beyond your control. For example, let's say we order for fasting C-peptide for a patient in the ward, and your lab doesn't do fasting C-peptide. The patient doesn't have money. You can't say, okay, let's go to social welfare and get this patient exempted, or let's take this to the HCC and get this exempted for the particular hospital, because our lab doesn't offer those services. Yes, you should follow the right channels. Alert the HCC. The HCC may know. Maybe they can refer the samples to another hospital that offers these labs. But if you're just quiet and you don't do that because it's not your problem, then that's a mistake that you keep making, and not only you will be suffering because you will be deemed as unserious, even the patients that you're dealing with are going to not get optimal care because investigations are not going to be done. It's just going to be guesswork. No, it could be this, it could be that, it could be this, it could be SLE, and we all know it's something else. So the mistake number 3, sorry, I'm reading through my script here. Mistake number 3 is you're not changing your mindset. Often people come in with 2 of the following things when they are starting internship. Actually 3, to come to think about it. The first thing is that they'll think, this is easy, I'm gonna breeze through it. After all, medical school was easy. I passed medical school. How bad could this be? That's one school of thought and what one individual may come in with during internship. The second thing is that, I don't think I'm ready for this. It looks like it's going to be challenging, it's going to be hard. Am I ready for this? Should I start? Should I volunteer here? Maybe next month, when they keep pushing it away because they're afraid. The third group are those that just, you know what? I'm just going to start. I don't care what happens, I'm just going to start. 3 groups of individuals. Whether you are in group 1, group 2, or group 3, whether you're those that feel it's going to be easy, or those that feel it's going to be hard, or those that frankly just don't care, you have to develop a change in mindset and switch your direction. What do I mean? If you are in group 1 who thinks that this is going to be easy, overconfidence is a problem. It may lead you into worse things than good. Of course, I'm not saying don't be confident. No one likes a doctor that is unsure. You should be sure of what you're talking about. You should be sure about what you're saying. So if, for example, you're not so confident and you're not so sure, patients won't even take the medication that you prescribe. Even if it's the right medication, they may take it, it may not get better, because psychological medicine is a real thing. Psychological therapy is a real thing, guys. It's a real thing. Sorry, I had to check on my audio source. It's a real thing. So if you are overconfident as well, you will become blind to learning new things because you think you know everything. You think that you did a good job in medical school. Medical school is different from working, guys. In medical school, on cold days, you can simply disappear and go home. No one is going to follow you up. Now with the whole of Lusaka in the hospital, all the medical students in the hospital, you have like 50 medical students, you can just disappear. No one will notice and no one will ask you much. But as you now graduate and become a junior resident, now the patients remain in your care. It's on your shoulders. You can't disappear when you want. Okay, you can, but the HR is going to be looking for you. So you can't disappear on your own. You can't just up and leave. There's this responsibility that you're carrying on your shoulders. And I always think of it like this. If I am dealing with a patient and this patient is sick, I always imagine, if this were my mother, if this were my father, if this were my friend, if this were my loved one, if this were my brother, would I be treating them this way? Would I be giving them the wrong medication? Would I be overconfident in a way that it's even detrimental to their health? Overconfidence puts you in a position whereby you can't even be corrected when you are wrong. And the seniors will frankly sometimes even just watch you. The nurses will watch you. And who tends to suffer? It's the patient. At the end of the day, patients die. Patients have disabilities. And it's all going to be on you. If you don't have a conscience, then I don't know why you're in medicine. If you do have a conscience, you carry that with you for the rest of your life. And those that belong to group number 2 are those that think that it's going to be hard. Again, if you are too scared, you lack confidence. You won't be able to take certain risks. Medicine sometimes is about taking the risk. Remember, you won't be a junior forever. You're not going to be a GRMO forever. There'll be a time when you finish your internship, no longer how long it takes, whether you become a chronic intern or not, you're going to finish your internship at one point or another. So once you finish your internship at that particular point, you become a senior resident. And if you're not so sure, you become one of those useless seniors that you even know, the juniors will even say consulting him or her is just the same as me doing it myself. So no one wants to be called a useless senior. So as you start your junior residency, or as you're through your junior residency, shift your focus and say, okay, of course, yes, this is not going to be easy. It's not going to be a walk through the park. So what am I going to do? I'm up for the challenge. I'm up for it. I'm ready to learn. I'm ready to experience it. I'm ready to take certain risks. And I want to have as much fun. I want to learn as much as possible. For those that don't care, I don't know why you're here. You can just move away. I'm just joking. Switch your mindset as well. Start showing some compassion. Like I said, always imagine, if this was my father, if this was my mother, if this was my sister, how would I envision this? How would I respond to this if they were treated this way? Then, of course, the fourth thing that is there is, of course, not asking for help. Yeah, so the biggest thing during internship is not knowing when to ask for help and not asking for the help when you're supposed to ask for the help. There are sometimes where you make diagnosis and you're not so sure, and you'll be too scared to ask for help because, they'll think that you are pancytopenic in terms of data. They'll think that you have academic anemia. They'll think like as if you have the diarrhea of the words but constipation of thoughts. Anyways, I'm done with my puns. Anyways, so you are afraid to ask certain questions. You are afraid to inquire because people will judge you. People will say, he's asking this, MK7, he's asking for the dose of quinine. It's bulky, it's wild. But don't let those people get to you, because at the end of the day, you will learn, even though you'll be embarrassed. Yes, it's part of the learning process. I'm not going to say there won't be any embarrassment. Trust me, there will be a lot of embarrassment. So you're not going to learn if you don't ask for help. You can ask for help from anyone. You can ask for help from the sister. Sister, what do you think the dose of this? Sister, what do you have? Sister, what do you normally give? You don't lose anything. If you ask someone for help, it doesn't take away your degree. It doesn't take away your knowledge. It, as a matter of fact, even adds or even either fortifies your knowledge such that now you will know the next time you're dealt with such a case, or you're presented with such a case, you'll be able to manage it smoothly and you look like as if you're an expert. Because remember, medicine is about experience. The more you see, the more you use something, the better you become. So don't be afraid to ask for help. Not asking for help is one of the biggest mistakes that you could ever make in your junior residency. And the final thing, and the biggest thing, which is the biggest fear in the junior residency for those that are doing junior residency, is being afraid to not know. What do I mean? You are afraid to say that you don't know. You are afraid to not know the answer. You are afraid when the consultant asks questions. Major word round, they're going to another word. You strategically make yourself busy. You strategically put yourself in the position, in the blind eye of the consultant so that they don't see you. They look for you and they will find you and they will expose you and they will embarrass you. So don't be afraid to say, I don't know. Not just to the fellow seniors or to your seniors and your fellow colleagues, even to the patients. I don't know is a better answer than lying. It's a better answer than telling the patient something that's going to kill them, or telling the patient something that's going to cause a complication. Don't be afraid to say, I don't know. Know what you know and know what you don't know. But how do you know what you don't know? Anyways, find a way to know how you don't know. So with that said in mind, those are the 5 mistakes that you keep making during your junior residency. If you enjoyed this video, subscribe to the channel. It goes a long way, and of course we are on the road to 16,000 subscribers. You know, yesterday I was going through my videos and I watched a lot of these hospital survival guide videos, and there was a point where I was very excited about reaching, should be 1,000 subscribers. I don't know if it's 1,000 or 9,000, one of the two, 1,000 or 10,000. I was very excited about reaching them. Like, in retrospect, if I look at this and it's like 9 months or 6 months ago, I was at 9,000 subscribers. And 6 months into the future, I'm now almost at 16,000 subscribers. I never really envisioned that would reach this point. You know, I had set a target that when we reach 25,000 subscribers, that's when that's the next biggest target. And I'm still having my sights on 25,000 subscribers. Once we reach that, then we want to double it to reach 50,000 subscribers. So help us reach the cause, 50,000. It's not bad. Stay hydrated, of course, with some water. Enjoy the video. Till next time, my name is Dr. Moses Kazevu. Bye-bye.